Welcome back. This is K24 This Morning. My name is Jeff Mote. Of course, at this particular point in time, we'll be having a conversation with the Nairobi Metropolitan Services Director General, Major General Mohamed Badi, as well, on various issues that have concerned the county on this particular one. So if you want to ask any questions, you can get me at I am Jeff Mote or at K24 TV. As we do that, don't forget, every single day you get a chance to get yourself a copy of your People Daily straight to your phone. It's only 10 shillings, by the way, and you can get that straight to your phone, all courtesy of the PD and Safaricom. The number that you need to dial is *550*4#. Once again, that number *550*4#. Dial that number and get yourself a copy of your People Daily straight to your phone. And as you do that, remember, you don't need any data on your phone for that. You don't need any other app to get the PD to your phone. Just that number, *550*4#. Dial it and get yourself a copy of your PD for only 10 shillings. It's brought to you by the People Daily and Safaricom. So get it and get fully informed as to the big stories of the day. From there, move it right along to the man of the moment and the man who's going to be shedding more light on how the county operations are moving forward as far as COVID-19 is concerned and development within the county. That is the Director General of the NMS, Major General Mohamed Badi. Good morning, Major General.
Good morning, Jeff.
Fantastic. Welcome to the show.
Thank you very much.
Asante sana. Let's start this off just as we open up this particular conversation, Major General, coming from the military background with, all this precision and hierarchy going on and getting into the rough and tumble of times of what is Nairobi city politics. How's the transition been for you, coming from that particular line of work into this particular space as you administer the NMS?
The transition has not been bad, Jeff, because the work I'm doing is mainly administration, which I was already doing at the military headquarters. So it has been not so bad because I just hit the ground running from the day I was appointed. My work is mainly to service delivery for the Nairobi citizens and the transferred tasks of transport and public works, water, sanitation, health services, environment, and of course electricity in terms of energy.
Okay. And this service delivery has come at a point in time where, the world is grappling with something that has never been seen before, this, of course, being COVID-19. So even in the best of times, your task was pretty Herculean. Now with COVID-19 in the picture, what's the significant challenge, the most significant challenges you faced as an administration trying to deliver this service with COVID-19 as a pandemic in this particular time?
Nairobi is the epicenter of COVID-19 pandemic. This is not unexpected as Nairobi has the highest population, especially in the informal settlements. As per yesterday, we had 17,763 cases in Nairobi, with 235 deaths. These roughly represent 59.5% of all cases in Kenya. The main challenge, mainly in Nairobi, is people following Ministry of Health guidelines, especially in informal settlements where social distancing is difficult to maintain. There is also this perception that COVID-19 is not a serious problem due to the current low death rates. So this is a big challenge in Nairobi, but that has not hindered us from achieving our objectives.
And even as you look at that, Major General, as well, we're coming from a point of view, you've mentioned some of the challenges that are being faced right there. Let's talk about some of the low-income estates around, the Nairobi County. When you walk into any of these settlements, you do see social distancing a major problem, wearing of masks also quite a challenge in this particular area. How are we dealing with this special subset? What special measures have been put in place? What's being done for these particular citizens?
In informal settlements, we started off by distributing free masks. And then the biggest problem was lack of water. So from day one, we started distributing free and safe water to all informal settlements. Then we started embarking on digging 93 boreholes in all informal settlement. These catered for the shortage of water, as water was very expensive to buy in the informal settlement. But once we were able to distribute free water to all informal settlements and disadvantaged areas, we have managed to reduce that menace of water. We have also supplied them with soap and sanitizers. During the initial phase of COVID, we had donors who gave us money to buy masks. We engaged the women in informal settlements to sew the masks, and then they were distributed freely amongst the population in informal settlements. And then, through the youth of Kazi Mtaani, the youth were educated on several tasks. One of them is cleaning up the area, garbage collection, clearing the drainages, and blocking the sewer systems, spraying the areas within their informal settlement, disinfecting all the areas, and then use them for civic education amongst the population in informal settlement. So this helped spread awareness, and with the supply of masks, water, and soap, that helped a lot during the initial phase of COVID.
And Major General, even as we look at that, also, let's stick to those low-income estates as well. The Ministry of Health giving home-based care protocols on how to take care of asymptomatic patients or those with really mild symptoms of COVID-19. When you go through these particular settlements, these low-income estates, do you think that's viable, home-based care, and how can that be rolled out as we try and, keep those numbers at a low and flatten this particular curve?
Yes, home-based care is working. So far, 3,480 have been discharged from home care after them being isolated. And, of course, our response team visiting them, guiding them, and where required, treating them. So yes, it has worked quite well, and we are still encouraging home care as we set up the isolation centers and treatment centers all around Nairobi.
as we look at that particular issue as well, of course, it's a period where not only do you have to deal with, like you said, administration of this particular unit, making sure service delivery is also done, but the reality of the matter is that it also happens within a political environment, and that's why we saw a bit of friction between the NMS and the Nairobi County government as well. Last week, we saw a show of unity between you and the Nairobi County Governor, Mike Sonko, and he said that you're going to work together moving forward. What were some of those teething problems that were there between the NMS and the Nairobi County government, and have they been resolved now as we move forward, Major General?
Whenever there is a new setup like NMS, there are always teething problems in terms of administration between us and the county government. But as we continue to work along with them, they have now understood our role, that it is not political, but only administrative. And of course, as we hit the ground running, we were able to achieve quite a lot during the 100 days, and Nairobi citizens started appreciating the existence of NMS. This has made the county government relax in their initial stand, and we are now working towards an amicable solution in order for all of us to achieve service delivery to the common manage.
And it's a good thing that you point that out also, Major General, because another issue of concern as well with the county government on that particular teething problem issue is that of accountability. How does it work with the NMS? Do you work hand in hand with the Nairobi County government? Can the County Assembly ask NMS any questions as to how operations are being done in terms of oversight? Is there a framework for that as we solve these teething problems?
Yes, NMS is very transparent, and we are accountable for all the funds that have been allocated to us. This is witnessed by the number of achievements that we were able to achieve in the first 100 days and continuing for the next 100 days. In terms of water, we built 93 boreholes during the initial phase, and now the second phase of 100 days, we are building another borehole, 100 boreholes. We also got a bigger fleet of water bowsers enabled to reach all the corners of the county. In terms of health, we have embarked on building 24 level 2 and level 3 hospitals in all informal settlements, so that to decongest the main hospitals like Kenyatta Hospital, Mama Lucy, and Bagathi. So we are working to increase the bed capacities in Mama Lucy and Bagathi hospitals. We are also expanding Mama Lucy Hospital and finishing up Korokocho Hospital, which both will be level 5 hospitals. So that will completely decongest Kenyatta Hospital, and we'll be able to take care of all the citizens within the county hospitals.
also, as you spoke about that, let's not forget, even as you got into office, one of the key directives from His Excellency the President, Uhuru Kenyatta, was as you get into office, you hit the ground running, you fight and dismantle these cartels that have been in this particular space. How has that worked out so far? Of course, you've spoken about what you're doing like with water, and that, of course, was a significant blow. But how has it been in terms of following that directive and, fighting and dismantling the cartels that you found in terms of hampering service delivery?
Remember, cartels are people you do not see. They operate mainly behind the curtains. But when you set the systems correct, like building up roads within certain funds, being able to supply all the Nairobi citizens with water, including informal settlements, and health, ensuring that the drugs are available in every hospital, recovering back grabbed lands for their specific use, renovating the green areas in Nairobi, and cleaning Nairobi River, ensuring that the pending title deeds that were due to Nairobi people have been given. This seems to scare away the cartels who have been using these services as bargaining tools for them to earn the illegal money.
And as you talk about some of the projects that you're putting in place as far as that's concerned, let's talk about even the roads as well. We've seen a lot of construction happening in terms of that particular road network. Some concerns that these are done very hastily. Will they stand the test of time on this one? Or will it be in 2023, 24? We're talking about they built this road back then very quickly, but here we are with massive potholes. What's the quality control even as you move forward, delivering in a 100-day period?
Some of these roads have been given to non-road construction company. NMS by itself has got an engineering section that deals with roads repair. So we have repaired the roads ourselves. And some of the major roads through Kura, we were able to get solid contractors to contract these roads to international standards. If you walk around the CBD, you will notice now that apart from recarpeting the roads, we have also set up the NMT corridors where people have walkways, and as you see, the red areas is for cyclists. So this was long overdue, and we have started with CBD, and hopefully we'll spread it around the country to every estate. So the roads are set up in the highest standards, and NMS is supervising the construction of all these roads.
Okay, Major General, and even as we wind up this particular conversation as well, you're an Air Force man, now firmly on ground delivering service for the citizens of Nairobi. What do you wish your legacy is as you leave this particular duty that you've been given by the President? When you look back on this particular period of your tenure as DG NMS, what do you wish your legacy to be?
Remember that the task I was given was to kickstart the regeneration of Nairobi. So NMS is about enhancing service delivery for the residents of Nairobi. So the legacy that we are going to leave is to leave Nairobi as a city of choice to reside in by raising standards of living and environment for the residents. We will also have a fully functional health system, reduce the traffic by enhancing transport network, better services for water management, greener, cleaner neighborhoods in what we intend to leave behind.
Okay, and you'll wait and see how that particular task plays out indeed, Major General. We've seen what you've done in 100 days. You've given the forecast for the next 100 days and what we should expect from that. And you'll be keeping a keen eye on the NMS as well to see what they deliver for the county of Nairobi. Thank you so much, Major General, for making time to be on the show this morning. Asante sana.
Thank you very much, Jeff.
And all the best with the work at the Nairobi Metropolitan Service.
Thank you very much, Jeff.
Asante, asante. Of course, that was in conversation with DG NMS, Nairobi Metropolitan Services, Major General Mohamed Badi, speaking about their 100 days, some of the challenges faced so far, but also what they're planning to achieve on the next 100 days. That's roughly 3 months as well. So it's something that we'll all be watching and seeing really what is delivered right there. Let's move it back to studio. In studio, we have